My name's Greg Sabo. I'm self-employed.
Greg, what were your initial complaints?
My initial complaints brought me here. I had numbness in my left hand, arm, left arm pain, real bad asthma. Asthma to the point where they were just trying to keep me out of the hospital. Low back pain. I couldn't walk more than probably 50 feet without having to stop and squat down because I would lose feeling in my leg, my left leg.
What did you try to do to help your problem that didn't work? Example, pills, doctors, physical therapy, traditional chiropractic, before you came to Upper Cervical Chiropractic of Monmouth.
I've been going to chiropractor my whole life. Most recently I was going 2 or 3 times a week just for regular adjustments, trying to get feeling back in the arm. I did get some relief with it over the past few years, but still not very functional with the left arm. The lower back was just a mess that really didn't do anything to help. And the asthma had gotten so worse. Actually, two weeks before I came here, my doctor told me that we were increasing my meds. I was taking 3 different inhalers. I was taking rescue inhalers every 4 hours just to breathe. And that's where I was.
How did this affect your home life, your work life, relationships, and hobbies?
I really couldn't do too much. Last June, my wife and I went to Atlantic City for her birthday, and we wanted to walk on the boardwalk. Just take a walk. It was a beautiful day, and I just couldn't do it. We'd walk a little bit. I'd have to stop and sit, or people are actually stopping because I'd be hunched down on the side of the boardwalk, and people stopping to see if I was okay. I said, "Yeah, I just have a bad back," and that's where my life had been. I just whatever I did, I had to just stop what I was doing to try to get feeling back in my legs so I can walk. With my arm, it was just miserable. I couldn't sleep, couldn't raise my arm. I can raise it now. But it was just bad life. And with the breathing, I was on inhalers every 4 hours taking a rescue inhaler. Now I have it in my pocket. I don't use it.
So how do you feel now?
I feel great. This past fall, I spent 4 hours out in the field walking without stopping. I can function now. My arm's better. My breathing is fantastic. I was actually at my doctor last week, and they took me off half my meds. They wanted to keep me on some of them just in case I have a little bit of a cold going on. So I'm just taking at night and in the morning. I haven't taken rescue inhaler in I don't know how long. I forgot. But that's good. I went from every 4 hours to not knowing the last time I took it. I carry it, but I don't use it.
Do you plan to continue on wellness care to stay healthy, and why?
Of course. I feel good. I'm going to do whatever I have to do to stay feeling this way. It's a game changer. It's really changed my life.
What would you tell others who are considering upper cervical chiropractic care but who are unsure about it?
I'd say do it. You got to do it. I've been telling all my friends. I now have, I think, 4 friends that come here. Started my wife here, and my wife's had great benefits. She had vertigo for 20 years, and after like 2 adjustments, she no longer has vertigo. So it's pretty cool. Good stuff.
Thanks so much, Greg.
You got it.